So hello, everyone. I know many of you, I see a ton of new faces or names. My name is Shada Esnasheri. I am the Drinking Water Program Manager here at River Network, usually based in Chicago, Illinois, on the unceded ancestral lands of the Council of Three Fires, the Ojibwe, Odawa, and Potawatomi nations, and I use she, her pronouns. I'm just going to do a brief introduction to the work that we've been doing at River Network and give you a little introduction to Max Gomberg, and then we'll get right into the presentation. And so at River Network, we believe in access to clean, safe, and affordable water for all, and that water assistance is just one approach to the crisis of water affordability in this country. A big part of what I and River Network have been working on over the last year or so is engaging and supporting our network on the issue of water affordability and water shutoffs. We initiated a peer exchange group at the start of the pandemic to bring together advocates working on addressing the issue of water shutoffs, which became, of course, an even bigger issue in the middle of a pandemic with stay-at-home orders and folks in homes without access to running water. We've pivoted over time to focus on this new federal low-income household water assistance program, which was created as a direct response to the COVID-19 pandemic. So it is an emergency program, and the need to support households in maintaining or restoring their water service. I'll put a link in the chat if you'd like to learn more or join the peer exchange group that I talked about. But without further ado, today we're going to hear from an expert on low-income water rate assistance and learn more about the Low-Income Household Water Assistance Program, also known as LIHWAP or LIHWAP, and key considerations for equitable and effective implementation. So our speaker today is Max Gomberg, who is most recently the Water Conservation and Climate Change Manager at the State Water Resources Control Board of California, where he led the development of water conservation, access, affordability, and climate change policies across the state. Under his leadership, the Water Board developed a statewide plan for low-income water rate assistance, adopted a comprehensive climate change mitigation and adaptation policy, and implemented regulations to reduce urban water use during California's last drought. Mr. Gomberg recently led an initiative to mitigate the impacts of COVID-19 on water systems and customers. He is currently working with the Water Foundation, supporting several advocates, including River Network, in understanding low-income water assistance, the upcoming program, and just advocacy efforts around water affordability, before he moves on to his next assignment with the Department of Health and Human Services, working on implementation of LIHWAP. So we have some real expertise in the room with us today. And without further ado, I'm going to turn it over to Max.
Thank you, Shada and April. Good morning, everyone, or good afternoon to those in the eastern part of the country. As Shada said, I am from California, located in the Bay Area on Ohlone land, and I've worked for the past 15 years for the state in varying capacities as a ratepayer advocate, and in the development, as you heard, of various climate change response and affordability policies and legislation. And I'm excited to be transitioning over to the federal government to help roll out this new first ever program at the federal level for water assistance. And in the meantime, I am consulting for the Water Foundation and supporting a number of NGOs working in this space. And so what I want to do today is really leave a lot of time for Q&A, but I'm going to give a brief overview of this program for those who may be more or less familiar with how it's set up, and really some of the key aspects of what is going to ultimately determine how effective it is, and even sort of stepping back from that, how we even understand effectiveness with a program like this, which is one-time funding across the entire country, with some direction from Congress, but not a whole lot of specifics, which leaves a lot of discretion for states and communities and tribes and territories in terms of its implementation. Okay, so we'll forward the slide. So for this program, as Shada mentioned, Congress has passed various COVID relief packages now over the past several months. This program was funded through two congressional actions, one back in December and one in March. And collectively, it's a little over $1.1 billion to be allocated by the Department of Health and Human Services to states, tribes, and territories. And the allocation formula is actually already up on their website, and I've got a link to that at the end of the presentation. And the way the money then flows is to systems, to water and wastewater systems, which are then supposed to effectively use it to reduce debt for households that those low-income households have accrued during the COVID-19 pandemic. There's also some broader language about affordability, but in terms of a prioritization scheme, it's really about COVID debt relief. And so that is the sort of the basic structure. But the reality for a program like this, as I'm sure many of you know, is that to make it work across what is a very large country, it requires a lot of other key participation, including many of the organizations that are on today, whether you are state-based advocates, local community-based organizations, and others who are in this space who really have a sense of where the needs are, how to get people aware of this program, how to make things like enrollment as easy as possible, and how to support some of the smallest drinking water and wastewater systems in the country, which don't have a whole lot of capacity to implement something like this, given what else they deal with and their general lack of staffing. And so really, I think for a program like this to allocate this money equitably at the household level is going to take a collective effort. And the more that there is engagement with the state or territory or tribal implementing agency, as well as state elected officials from community groups who really know how to work with people, that's really going to be key to the success. As well as in some cases, given the practical challenges of the fact that people have debt, the holders of that debt, these water entities, don't know generally who their low-income customers are. There's going to have to be a whole lot of data exchange required, and in some cases, there is a role for both NGOs and private sector entities that can facilitate some of that. And I'll get to that in a little more detail as we go forward. Okay, moving to the next slide. So what is this program? Again, it's a little over $1 billion, and HHS already made a couple of key decisions about it. One is the administrative and overhead component. They put that at up to 15%. So for every state that is administering these funds, and as well as the 5 populated U.S. territories and the dozens of tribal nations, they've already got, if they've asked for it, the 15% of their total allocation for administrative expenses. And that really is important because that can go towards not only staffing for the departments or entities that are administering this at that state level, but also in terms of contracts down to local governments, NGOs, others to support the administration of the program. Now, as has been mentioned, right, this is a one-time funding allocation. However, there is current legislation moving through Congress that would provide substantially more money. It's in the overall infrastructure package that passed the House last week and is now in the Senate. And there are some others on this call who've been involved really greatly with that legislation. So I've been involved too, and if people have questions about that, we can get to that as well. In terms of where is this program actually going to roll out? How is it going to be ultimately effective or not? The key to understanding the where of this is we've got over 50,000 just drinking water systems across the country. Most of those systems, over 45,000 of them, serve very small populations. And if you can think of the breakdown this way: about a little over 45,000 drinking water systems serve about 17% of the U.S. population, and the remainder of roughly 4,000 and some water systems serve over 80% of the population, and slightly under 500 systems serve almost 50%. So we have our sort of major population centers, our major metros served by generally large utilities, and then the rest of the country served by many, many, many smaller systems. And this is part of what makes water and a water program very different from, say, electricity or telecommunications assistance programs. There are many fewer providers or utilities in those spaces, and so the administrative logistics look very different than something where ultimately for someone to get a credit reducing debt on their bill from a system that serves a population of, say, several hundred or only a few thousand people, and is not running advanced software, that's where things can get complicated. And then, of course, there is the rest of the ecosystem of entities that are really going to be integral to making sure people even know about this program. The media, of course, for getting the word out, but then other local officials, and in particular outside of our major urban centers. Making sure that, again, not only the people who are involved in running those systems have the capacity to reduce people's debt on their bills, but that the people working in those communities and the people who live in those communities, if they're eligible for assistance, that they know how to get that assistance. And if they can't be automatically enrolled and simply receive a credit, that they can enroll in this program and receive those benefits sort of in the most efficient and least burdensome way possible. Next slide. So in terms of, whoops, I think one back. Okay, so on the when, in terms of the timeline here, the administrative allocations, as I mentioned, that 15% have already been allocated to the states and the tribes and territories that have already indicated to HHS that they will be participating. At the state level, 49 out of 50 states have indicated they want to run this program. North Dakota has declined. So things are going to look very different in North Dakota. By August 9th, so this is coming up, the states actually have to submit a pretty detailed application to Health and Human Services about how they intend to administer this program. And then expenditures have to be out by 2023. And that date gives time for getting a program up and running. Of course, the real goal here not only is to equitably allocate the money, but also to do so expeditiously, given that people have been, in some cases, are continuing to accumulate debt due to being unable to pay their water bills and being in economic crisis, and the need to do this quickly so that we can try to reduce shutoffs and other types of really damaging responses by water systems on households. So why is this program here, and why is it happening? Well, of course, it's here because of the COVID-19 pandemic and the fact that many states put moratoriums on shutoffs, and people were out of work, unable to pay for many basic expenses, including their water and wastewater bills, and the fact that early on, some people made the connection that access to water, of course, was key to achieving public health goals, hand washing, sanitation during a global health crisis. But the other thing I want to focus on is part of the reason this program exists now, and part of the reason there's a push for a longer term, more well-funded program at the federal level is because of the work of advocates. Whether those are advocates in Michigan who have been fighting so hard since the terrible tragedy unfolded in Flint and continues, to tribal advocates, to advocates in other states who have really been pushing for affordability in the water sector as something that needs to be recognized at the federal level, funded at the federal level, in the same way that assistance programs are funded at the federal level for essentially every other basic need, whether it's housing, electricity, telecommunications, food. So this program really is a testament to continued and sustained advocacy by many people, including, I know, many of the people who are on today. Next slide. So how is this actually going to work? Well, ultimately, again, this is about 50,000 plus billing systems and making sure that the money is allocated and credits go on to bills. How this will actually work, of course, like everything else, is going to depend in part on the ideologies and the politics that exist in each part of the country at both the state government or territorial government level, and then sort of at the local level. And what do I mean by that? Well, I already gave one example, right? The state of North Dakota has already elected not to take these funds. That was a politically or ideologically motivated decision, and hopefully there will be ways to get funding to households that are in need in North Dakota. It's going to be more challenging without the state government playing an active role. It's also going to depend on simply capacity. Like I said, with over 45,000 systems that have very limited staffing, maybe very limited technology in terms of how they calculate, issue bills, track payments, that capacity where it needs technical assistance and support, again, that speaks to this administrative component of the money and how states are using that to support capacity development at small systems in small communities. And of course, it depends on human capacity, people being able to figure out ways to, for example, transfer eligibility lists, for example, for people who are already eligible for other assistance programs, already receiving food benefits, electricity assistance, what have you, and automatically transfer data of those households to water systems so that they can automatically credit people's bills without requiring yet another enrollment form that people have to fill out. That type of capacity is going to be essential to how well this program ultimately functions. And then, of course, that speaks to the coordination. This is not just something that a state government agency can do on its own. It's going to require support and cooperation from the water systems themselves. And again, close monitoring, support, and assistance from communities and organizations that work with communities across the country, and particularly outside of the major metros. And then, of course, doing something like this for the first time, standing up a new program, it's a big lift. I think it's a good thing that HHS is bringing in people from around the country who have both utility experience and sort of state level administrative experience to help them roll out this program and support the states that want to do well with it. It's also going to take really compassion by a lot of people who are involved to ultimately make sure that, again, people know about this program, they are able to benefit from it, and that when issues do arise, when there's not a match of the name of the person in the household who is the one who gets the electric benefits, for example, to the person who's going to be receiving the water benefits, that someone is there to work through that, to figure out what's going on, and not just give up on automatically making sure that whomever is living in that household is benefiting from this program. That is ultimately a function of compassion of people who are involved in administering a program like this. Next slide. So some of you have probably seen this triangle before. There was a skit I was looking for, I think, many, many years ago on Saturday Night Live or some such show, where someone hires a contractor to do something at their house, and the contractor says, "Well, you get 2 out of 3, right? If you want it done fast and you want it done well, it's going to cost you. If you want it done well and for reasonable cost, it's not going to go fast, right? You can't get all 3. The reality is, for any program, whether it's a national program like this or a local program, right? We do want all 3 to the best extent that we can. That is, we want a program here that is getting benefits out quickly, so that, again, people aren't burdened by debt. We want a program that is well run, so that it is efficient, that the benefits are flowing equitably out there. And then also, we don't want to overburden the administrative cost, but at the same time, the reality is getting a program like this up and running well is not something that can be done on the cheap. It really does require an investment of resources, financial resources, human resources, to make it work well. And so I think this is really important to keep in mind as this program develops. If you're seeing your state government try to shortchange it, I think that's going to really be a point of intervention for advocates to say, you can't do this with 2 staff at your state agency. It's going to take more people. You're going to need to work with community-based organizations to get the word out, to help build that technical capacity with the small water systems, and to make sure that the enrollment and the tracking is effective and as comprehensive as possible. This is a program that ultimately aims not for complete universality. That is, it's a means-tested program, right? You have to be low income to qualify, but within the population of the country that is income qualified, it is supposed to be as universal as possible. And to do that, and to really try to reach for that goal, requires a significant investment of time and resources. Next slide. So I've touched upon some of these as I've talked through this, but I really think that these are some of the sort of the key considerations. And I do encourage everyone to look through the model plan that HHS has posted on its website. It is pretty comprehensive in terms of the questions it asks the administrators, again, the states tribal governments and the territories to go through to document their thinking and their planning for how to allocate this money. But enrollment, can that be done automatically? Again, can people who are already enrolled in other benefits programs be automatically enrolled in this one? Again, that's ultimately where rubber hits the road. That's a data and technical issue that can be solved, but it requires resources to transfer information about households receiving benefits from other agencies to a state administrative agency, and then to share that while maintaining appropriate privacy protections with water systems so that they can make direct credits, again, without someone actually having to fill out yet another form to prove that they are eligible for assistance. Partnerships, again, so many, tens of thousands of water systems around the country serving small communities. That's a lot of need at outreach, partnerships with a lot of different organizations to make sure that they are able to receive money, credit people, and track that, and then that we see the data flowing back up to the state level and then ultimately to the federal level to see how well this program is achieving its goals of, again, reducing people's debts, making water more affordable, reducing shutoffs. Technical assistance goes along with the outreach piece, but again, this is specifically for the smaller water and wastewater systems around the country that in many cases do not even have full-time accounting or bookkeeping or financial staff who are there to really ensure that, again, data is being collected, bills are being done accurately, credits are being applied appropriately. That requires assistance and, frankly, oversight. And then that also speaks to the data piece. In order to see how a program like this is working, both at the state level and at the federal level, there needs to be good data. There needs to be transparency about the data. There needs to be transparency about how the benefits are allocated. And then also the level of the benefit. And that is, HHS is holding a webinar or workshop on that tomorrow. But the benefit levels can vary. There is discretion there. And certainly this is where things can get complex given how many people have accumulated water debt during COVID, and the fact that this is a not insignificant amount of money when we're talking about $1 billion, but also not a tremendous amount of money, spreading that across 49 states, 5 territories, and dozens of tribes. And as one of my colleagues has said, the goal here is to give meaningful benefits and avoid the type of situation that sometimes occurs in class action lawsuits where everyone gets $2, and was it really worth filling out a form to get a $2 credit? I don't think that's going to be the case here with this program, but again, sort of those benefit levels and that calculation is going to be really critical to, again, how effective is this for any given household in terms of their debt burden, in terms of avoiding loss of access to drinking water. Next slide. And of course, a program like this, again, if it's going to be shown to be effective, if there's going to be sustained political support for a longer term affordability program, there needs to be data to support it. This list under metrics is really just a small example of all of the different things that this program could measure. And that what gets measured ultimately will be a function of what HHS thinks is sort of the most critical data, and then at the state level, what people want to see. So again, I encourage all of you to be thinking about this for your states or tribal or territorial government. But I think, some of these that I listed here are really some of the key metrics that we're going to need to look at the national level. Right? How universal is this, right? What percent of the households that are eligible are actually receiving benefits? And that will really tell us how effective the outreach, the enrollment processes have been. Ultimately, this is about maintaining access to water, which is critical for daily life, and reducing the use of shutoffs, which are really a punitive measure for people who are struggling to pay bills. Reducing debt overall as well, and then equitable allocation of the benefits. And I think many people will recall this is but one of many examples where equitable allocation didn't happen in the aftermath of Hurricane Katrina. There were benefits that should have been flowing to mainly Black populations in and around New Orleans that were flowing to mainly white populations in Mississippi. And so guarding against that again is really critical for a program like this to be administered equitably. We need this data because we need to know what really is going to support long-term water affordability. And I think also, I encourage people to think about the partnerships element here. Where are there opportunities for organizations that have traditionally worked in the public health space, in the water and environment space, to be in this affordability space and supporting organizations that have worked in the affordability space, but maybe in other dimensions of it, right? Again, whether that's on the food benefit programs, housing, electricity. So I think there's a lot of opportunity for partnerships here as this water program rolls out, and I see that as a real positive, potential positive of this program. And then, of course, states or regions may have other types of goals. And again, this really should be informed by groups that know what's going on the ground in different regions, and can articulate and push for those goals with your state program administrators, as well as state legislatures, which may or may not decide to get involved in how this money is allocated. Next slide. So as I mentioned, HHS is holding a webinar tomorrow to talk about program and policy guidance. I have no foreknowledge of this until I'm formally an HHS employee. I don't get anything from them, but I presume they're going to talk about just different models for that calculation of benefits. And so there's the detail for that. And again, up at the top there, that link will take you to the model plan where you can see what the questions they're asking for those August 9th submissions from states, tribes, and territories are. It's a pretty extensive application. And again, I encourage everyone to look through that. So that's my presentation for today, and I'm happy to talk through questions and touch on a number of other issues. I will say, I know that one issue that's come up in particular in questions I've seen has to do with people who pay for water indirectly, people whose water costs are included in rent. I'll just say that is open-ended. That is a state that does want to try to figure out how to get benefits to renters can do that. I personally think it's going to be a big challenge if a state wants to go that way. We spent a lot of time in California trying to figure out whether a state level water affordability program could reach renters in a effective, efficient, and equitable way. ultimately we landed on a proposal that would give people who rent additional money on their annual tax filing form in the form of a tax credit, because the minute you deal with direct payments or landlords, things get really messy. So that's, I will flag that as something that I didn't cover, but happy to talk about more if people want to ask about that during Q&A. So again, thank you to River Network for inviting me to present. I think this is a really important new program, and as with all new programs at the national level, it's going to take really a team effort and a lot of pushing and oversight from advocates to make sure that it functions as Congress intended. And with that, I'll hand it back to Shada and April.
Thank you so much, Max. I am going to I'm going to share my screen here in just a minute to bring up the questions that you all have been asking. And if you have other questions that come up, or if you're not able to access the Mentimeter link, you're welcome to put your questions in the chat. And if you want to ask a question verbally, you can also let us know in the chat or raise your hand or just come off mute, and we're happy for you to ask questions verbally as well. So give me just a second to bring those questions up, and we'll take a look and see what questions you all have for Max. Give me just a second. All right, so Max, the first question that we have here is, how do we plan for the short-term implementation of this program while also working on the long-term issue of water affordability? What's your advice there?
Well, I have two pieces of advice there, and I say this tongue-in-cheek, but actually I'm serious. I think that the funder community, which has really only started to understand this issue and take it seriously, needs to provide more support to the NGOs working in this space for this very reason, right? We've got an immediate short-term program that's going to require a lot of time and focus, and yet we also need to be working towards a longer-term program that requires resources. So there are national level foundations which have just started to sort of edge into this space, if you will. I'll call out one of them, which is the Robert Wood Johnson Foundation. They need to be providing more money to the organizations that are working in this space. And so I think that's a series of conversations there and pushes from advocates. So that's one, because it really does take more resources. And I think the second is a little bit of do what you can with what you have, which is maybe you've got other organizations that your organization sort of works in partnership with, and you try to do a little bit of divide and conquer, as it were. That one organization is really going to focus on the immediate program, and one organization is going to focus on the lobbying and strategy for the longer term program, and try to keep in contact as much as possible. It's a big lift, but there is the proverbial window of opportunity is open right now. And so as many resources collectively, I think as we can bring to this water affordability space in this present moment, the better chance for a both effective and equitable short-term and longer-term outcomes that we can have.
For that, Max. I do want to raise just a logistical question that came up here about tomorrow's webinar with HHS, and it says it's for grantees, but is anyone allowed to attend? And I believe the answer is yes, it's open for registration, but just wanted to confirm from your perspective.
Yeah, from my perspective, the answer is yes. You know, they put this out in a public space with the link and the information anyone could use to participate. So that makes it an open forum. I don't know if they'll take questions from entities that aren't direct grantees, but again, I don't get that type of communication from them yet. So, but I think anyone can log on and listen.
Yep, and they do make it kind of difficult to find these things, but that's the way they've been doing it. The next question, I just wanted to pivot really quickly to HR 3293. Again, thinking about this short-term versus long-term programming. So the question is, does HR 3293 include permanent funding or just another influx of one-time fund?
So HR 3293 includes $8 billion in funding, $4 billion for drinking water and $4 billion for wastewater. It does not say that there is the congressional intent to make this an annual appropriation. That level of funding, would sort of keep things going for a number of years. I think the idea, particularly in terms of the author's office, and that's Representative Blunt Rochester from Delaware, is that this is sort of the entry to a permanent program, but there isn't a dedicated permanent funding source beyond what is there in the initial appropriation.
Thanks for that, Max. There's two questions here that seem possibly related. So the first is, with the complications of small vendors, how does HHS, OCS envision reaching small entities that provide well water? And then there's another, I think, related question here around if this will be expanded to include rural areas where wells and septic systems are the source of clean water and wastewater systems.
So my understanding is that, again, this is going to be left to the states or tribes or territories that are implementing this, that if they want to design a program that reaches domestic wells, and people who rely on those, that they can do that. And again, so long as the user is income qualified, that's the main screen, that they could receive a monetary benefit through this program. Functionally, how that would work, again, is that if that person or if people in that community are already enrolled in other benefits programs, and the state has a way of transferring sort of that automatic enrollment direct benefits, people could receive those benefits. Now, since they're not paying a bill, they wouldn't receive a credit the way that other people would, right? They would have to the state would either have to say, okay, we're going to bump up your electric benefit or your SNAP benefit or some other benefit to sort of account for this water piece, or someone would have to get some type of direct payment. So again, that's another layer of administrative complexity that, again, I think if it matters, if people think that needs to be a part of this in a state, then they're going to have to push their state to do that. Now, I'm seeing a comment that says it can't. I think there's a little bit more of a gray area there in terms of how a state could actually run this, that could make it possible. But Larry Levine from NRDC, is saying the funds have to go directly to a utility. Again, I think a state could sort of define things in a way that could support communities that are not directly served by a utility. But I do think it would be yet another hurdle, and there would have to be some back and forth with HHS about interpretation of the statute in order to do it.
I want to kind of follow on that with this question about funds being able to pay water bills that are billed through a third party that is not the actual utility provider. And then following on that, just this question about state level distribution of funds rather than local utility distribution, and which is more efficient long term in terms of capacity, consistency, and administrative costs.
Okay, so that second one, that's a big one. But I think the first one, where it's third-party billers, again, a state is going to have to figure out whether they would want to continue sort of routing this money through third-party billers. That's going to require a lot more sort of oversight. I mean, I think there is obviously anytime there's a bunch of money being given out, some people get very concerned about waste, fraud, and abuse in terms of how that money is being allocated. But I think having a third-party private entity in the middle of things makes those concerns, let's just say, more legitimate. And so, again, but that's going to be a state-level programmatic and policy decision about if a utility isn't doing direct billing, are they going to require the utility to do direct crediting with this money, or they are going to allow that utility to sort of effectively delegate that to that third party service. Again, from an administrative efficiency standpoint, a third-party service that is already doing this could also do the crediting. But again, you've got another entity where money is flowing through that entity, and it does raise some, I think, thorny oversight questions. Sort of stepping back to the larger question about state-level administration versus utility-level administration. Here's how I would answer that. With so many water systems that are small, serving small communities, the idea that you could have a program ultimately that sort of runs through utilities at the individual level, I think it's not really realistic. It's not pragmatic. Ultimately, there are efforts afoot to sort of shrink the number of water systems overall, because you get so many more administrative efficiencies and just better capacity when you have a system that's got a larger customer base and can have professional staff. That's a long-term project. There are a lot of equity issues involved in that. But in the meantime, I think there is this concept where, the largest systems, your big metros, the biggest cities, your Chicago's, your Denver's, your Atlanta's could run something if they wanted to, and then the states could run it for sort of everyone else. But again, there are sort of benefits and drawbacks to that type of hybrid model versus just having a state level program. So again, this is what makes water far more complicated than, say, the electricity space, where it's such a smaller number of utilities that provide service. Most of them are big. They have sort of all of the capacity to do this that many of the water systems just don't.
Thanks, Max. There's a few comments and questions here that are related to delivery of information from OCS, transparency, and OCS communicating to states exactly what you've been saying about investing in the delivery system, and just questions of can you keep that message resonating when you get to HHS, and also just continuing to open up the black box and the transparency of this information out to the states.
Yes. Yeah, I mean, I've been telling them every chance I get, but again, I'm not sort of in the loop yet, but I very much, I firmly believe in that. And I hope that they listen. And I hope that you all continue to sort of advocate as well. And I think it's clear to me, I think it's clear to many of you who've been following this, that the transparency from them in terms of how this has rolled out hasn't been there. They are not familiar. Their model, their go-to is LIHWAP. They work directly with state level administrative agencies. There's not a whole lot of public process. There's not a whole lot of input. This is a new program. It's a different utility service. It's a different set of conditions. There's a lot of interest, and they need to really enhance the transparency and sort of overall stakeholder engagement with people who are not the direct grantees. So I will definitely continue to push for that.
Thank you, Max. I'm going to try to group together some more questions because I know we're running out of time. And so we have some questions about why things like small leaks or plumbing repair were not part of this program, and thinking about how this is a bill payment program and how will this actually address the cost of water across the board. So recognizing that water leaks are a big driver of water affordability issues in many places. And yeah, just the logic behind this program.
Yeah, I can speak to that. So the logic here, right, is this is really an emergency response / stimulus program. The idea here is to get money out to reduce the debt that people have been accruing because they lost their job, or someone got sick, right? And people haven't been able to meet their, pay their basic bills, including the water bill. And so the idea here really is, bring down the debt and also reduce the debt load for the systems themselves so that they aren't in a financially precarious position, especially those smaller systems. And so as a one-time sort of emergency response program, I think, the thinking is that's where the focus needs to be. In terms of the leaks and sort of conservation incentives overall, other aspects of this, those are contemplated in 3293 broadly as sort of the longer term types of assistance that will help with affordability. And I would agree that sort of leaks on the customer side of the meter are a big driver of high bills in many instances. And there's a lot more support that's needed sort of at all levels of government to help people identify, fix those leaks and not have that be a driver of really high bills and debt.
Yeah, and there's a couple of questions here too, Max, that are, I think, related to that, about that a lot of times our water bills include our sewer service and also our trash services all, lumped in there together. So if a person can't afford their water bill, they may lose access to a number of essential services. And if there's any ideas of whether this program may be expanded to help deal with to meet these other needs as well as the water bill?
Yeah, no, this is a really important element, and this is true again across the country. I mean, all kinds of stuff gets thrown on water bills. In some cases, right, in many cases it's wastewater, but in some cases it's trash. In some cases, water and electricity are on the same bill. Some people pay various taxes and fees on their water bill. It's a problem, and I think sort of from a long-term perspective, one of the key things, and I'm hoping that this ultimately will make it into whatever legislation makes it through Congress, is that entities that are taking this money need to effectively allow for partial payments. That is, if someone can make a payment of some amount on what in many cases can be a large bill because it's got all these things on it, they get to maintain service. Right? You can't, if someone is willing to pay $20 a month, then they can't be shut off just because their total bill is 40, 60, 80, what have you. So I do think we need to be working towards that. This program, again, is supposed to be for water and wastewater assistance. But again, if it's one bill, many of the water systems that do billing, sometimes they can line item things and say, well, how much of the debt is related to this or that? Sometimes they can't. And so, again, I think a compassionate state level program administrator should be able to say, look, it doesn't matter what's on the bill, right? It's we're going to allocate benefits according to need and in a way that maintains access to the critical service, which is drinking water. No one gets their wastewater service shut off. Right? That's not how that works. That's really a key linking element here, is that the states and then the utilities that are receiving this money need to maintain service for people who are receiving the benefits, irregardless of sort of what goes on that bill.
Thank you.
Thank you. Okay, I'm going to squeeze one last question in here as we come up on time, but we have a question here about how the LIHWAP funding and HHS's vision for it to coordinate with other funding sources. As you mentioned, there's a large sum of money, but it's not nearly enough for the need for water bill assistance. So thinking about other funding sources for water and wastewater utilities, like the Emergency Rental Assistance Program, Community Service Block Grant. I saw something in here about SRFs as well. So just thinking about all the funding that might go toward water and making it affordable, how this program might interact with those.
So I think, again, this program being an emergency assistance program, there are some sort of coordination, co-funding opportunities potentially, but I think in part that goes with some of the other utility assistance or rental assistance that's flowing out through the states from the federal stimulus bills as well. When it comes to, again, sort of this longer term affordability coordination, I do think it's absolutely critical that let's just call it the broader infrastructure funding, whether that's money that's flowing through the state revolving funds, whether it's money that's flowing in direct grants. For example, the money that, again, if it makes it through the Senate, will go for lead service line replacement. That money is being coordinated so that people, again, aren't having to fill out one application to get a lead pipe replaced and another application to get a credit on their drinking water bill, right? So there's definitely opportunity for coordination sort of looking ahead, but I do think the need to sort of expeditiously get this money out the door means that there can't be just sort of a long lead time for, well, how do we coordinate with, these 8 other programs? So there is a balancing act there.
Great. Thank you. Okay, I'm going to go ahead and call it there. Thank you so much, Max, for your presentation and for taking time to field these questions. Thank you all for your questions. As a reminder, we did record this session and we will be posting it on our YouTube. We will also be making Max's slides available to you all. And I think it's safe to say that we're going to have a great ally at HHS in implementation of this program. So thank you for all the work that you do, Max. And again, thank you all for participating today.